It's not hard to believe that when you're in physical pain, you may also be suffering from mental anguish. For the past 4 years, researchers have been studying this link. About a third of seniors suffer from low back pain. Nearly 20% of Americans aged 65 and older have clinically significant symptoms of depression, according to the National Alliance on Mental Illness. Researchers at the University of Pittsburgh School of Medicine are studying the most effective means of treating chronic low back pain and symptoms of depression together in those 60 and older. The ADAPT study, addressing depression and pain together, has been going on for 4 years. 75 men and 123 women ranging in age from 60 to 94 have taken part. The specialists at Gulfcoast Spine Institute explain how the efficiency of minimally invasive surgery could improve your physical and mental well-being.
Over the last, I would say, 15, 20 years, the new thing is just having a person that just specializes in spine. And that's what we do here at Gulfcoast Spine Institute. We encompass the whole thing. We do the decompression, as well as if it needs to be stabilized, we are able to stabilize, and we do it through minimally invasive techniques, whereas the majority of surgeons are still doing traditional spine surgery.
Almost all of my lumbar surgeries, whether they be just simple decompressions or fusions with instrumentation, I can do them all in a minimally invasive fashion through small incisions. So when you do something with little incisions, you have much less blood loss, much less post-op pain. And more importantly, you're not destroying the back muscle to get down to the backbone. A lot of the post-op pain, blood loss, and rehab from open procedures is because of the actual surgical approach. Not so much from what you've done to the bone or the repair on the bone or the fusion, but how much destruction you've made to the soft tissues to do that. So we have very little blood loss, extremely low infection rate, and a very quick return to normal daily life and activities.
What we have found are patients that have been living with pain, and surgeons that are not minimally invasive surgeons, they have not offered them surgeries because it would be too much for them, too much for the patient to undergo. We're able to do a lot through these minimally invasive techniques, and I'll tell you, our average patient population, let's say their late 70s, we do patients in their 80s, 90s. Most of our procedures are less than a half an hour, and minimal blood loss patients tend to go home the same day.
For more information about the Health Grades Honored Surgeons and the Medicare covered services available at Gulfcoast Spine Institute, please click the Healing Powers story icon on our homepage, yourhometownhealth.com.